Welcome to Express Updates. I am Yaira Awuno. Now to our headlines. Finance Minister directs 80% Dacf transfer to Assemblies. Minority demands action on 6-month delay in Ablekuma North poll results. IEAG urges immediate termination of GRA's remaining contracts with SML. Healthcare crisis deepens as nurses and midwives continue industrial action. In our first story, the Minister of Finance, Dr. Kasil Atuforsen, has directed the Fund Administrator, Michael Harry Yamson, to transfer 80% of District Assembly Common Fund directly to Assemblies. He added that the Fund Administrator is required to submit expenditure returns to the Ministry of Finance before subsequent releases will be made.
Addressing members of parliament in a brief on the payment to statutory fund, the minister said over 987 million Ghana cedis has been transferred from the consolidated fund into the DACF account, being the 2025 first quarter amount. According to him, the move aims at improving the financial strength of metropolitan, municipal and district assemblies and spur local economic development. He called on MPs to monetize the utilization of funds disbursed to their respective assemblies in line with the approved guidelines by Cabinet. Touching on other statutory funds, the minister said that all transfers have been made promptly and in full.
As at yesterday, the District Assembly Common Fund has received, and we have transferred the sum of 965,073 Ghana cedis from the consolidated fund to the District Assembly's Common Fund, being the first quarter amount due the District Assembly Common Fund for the year 2025. Mr. Speaker, our resource extends beyond mere release of funds. We have taken decisive steps to ensure that these resources are utilized in line with government economic objectives.
He also disclosed that over 2 billion Ghana cedis has been transferred to the National Health Insurance Fund, covering 2025 first quarter. The fund seeks to, among other things, settle arrears owed to healthcare providers. Similarly, the Ghana Education Trust Fund has received over 2 billion Ghana cedis for the months of January to April 2025. He reiterated that the funding for the free senior high school program is currently fully covered under the GETS Fund. Dr. Atuforsen called for a collaborative approach to strengthen the MMDAs and position them as engines of local economic development.
Amount of 2,033,469,607 Ghana cedis has been disbursed to the National Health Insurance Fund, and they have received the funds. These disbursements have enabled the National Health Insurance Scheme to settle arrears owed to healthcare providers and to implement the free primary healthcare and the Ghana Medical Care Trust Program, otherwise known as Mahama Cares. Mr. Speaker, similarly, the Ghana Education Trust Fund, GET Fund, has received a total of 2,710,227,947 Ghana cedis. Mr. Speaker, 2.7 billion Ghana cedis for the month of January, February, March and April 2025, all transferred and received by the Ghana Education Trust Fund.
Now, minority members of parliament have marched to the police headquarters to petition the Inspector General of the Police over the Electoral Commission's delay in declaring the Ablekuma North parliamentary election results 6 months after the 2024 general elections. Led by Minority Chief Whip Frank Anodompre, the members of parliament urged the police to provide the necessary security for the EC to announce the results without further delay. Anodompre described the prolonged silence as a violation of the people's constitutional right to representation and demanded immediate action to uphold the integrity of the democratic process. The Executive Secretary of the Importers and Exporters Association of Ghana, Samson Asaki Awingobit, has called on President John Dramani Mahama to cancel the remaining contracts between the Ghana Revenue Authority and the Strategic Mobilization Ghana Limited. Despite a presidential suspension of SML's upstream contracts in April 2024, the company still receives over 1.43 million Ghana cedis monthly under its downstream agreement. Awingobit condemned the payment as a waste of public funds that could be better used for national development and urged stakeholders to push for the contract's termination. And finally, healthcare services across Ghana have severely been disrupted as members of the Ghana Registered Nurses and Midwives Association continue their strike, causing major slowdowns and closures in hospitals, particularly in the Ashanti and Volta regions. Key departments, including family planning and specialized clinics at Menchia Hospital, have shut down, while physician assistants in Hohoe have taken over some outpatient duties amid the strike.
Deputy Chief Medical Officer Dr. Edu Boache highlighted the strain on medical staff who are struggling to manage patient care without nurses and midwives. Courage Kuma, GRNMA's regional chair, called on the government to urgently improve nurses' welfare and conditions to end the strike, warning against unauthorized personnel handling patients due to public health risk. Talks between authorities and striking health workers remain unresolved, prolonging uncertainty over when normal healthcare services will resume.
And that's all we have for you here on Express Updates. I am Yayura Awuno. Do enjoy the rest of our programs.